We'll get started with you. Thank you all so much for coming. The floor is yours, Commissioner.
All right. Thank you so much, Council President Hurst. It's good I woke up this morning thinking how good it is to be alive. You know? Isn't
Absolutely.
that good? All right. So the update for the City Council today, I have several things for you. The first one is the confirmed cases for the Commonwealth, as you know, is 106,128. Probable is 6,219. People have asked me about probable, and probable simply is a positive serology, meaning a positive antibody test plus symptoms, but they don't have a positive COVID test. So that is what probable is. Hannah County yesterday had 7,056, which was 6.65% of the state. Springfield, 2,741, which is 39% of Hampden County and 2.58% of the state. The deaths were 8,152 at the state level. Hampden County deaths were 681, which is 8.35% of the state. Springfield has 124 deaths. That is 4 additional deaths than I reported to you the last time, and that is 18.20% of Hampden County and 1.52% of the state. Long-term care facilities in the Commonwealth still accounts for 65% of the deaths, and that's 5,303. In Springfield, that 124 represents 56 white, which is 45.16%, 37 Hispanic, which is 29.83%, and Black is 29, which is 23.83%, and Asian is still 1.61%. We did test one additional homeless individual who tested positive, and they are being cared for by their facility. Testing, again, the testing I have mentioned, as you know, the governor announced testing sites. However, there was none in Western Massachusetts. I continue to have conversations about that, and I'm very appreciative of those legislators who are advocating for Western Massachusetts site. As you know, this appears to be the second time that Western Mass was left out of the testing equation. We do have hotspots in the city of Springfield, and we would love to stand up test sites so we can test asymptomatic individuals who just want to walk in, so we can understand the penetration of the virus. We want to make sure people have testing and it's free, so that we can encourage everyone to be testing. Testing and tracing is very important to us, not going backwards in Massachusetts. Contact tracing is important. I think you all know that. I encourage all the residents of the city to comply with our testing individuals. We're keeping all of the testings and contact tracing in-house right now. We are not sending them to the Contact Tracing Collaborative, which is having its own set of challenges, but we're doing it internally. We have gotten reports of people posing as contact tracers in order to get personal information. We will never ask for financial information or for a person's social security numbers. Lots of calls about individuals who are not complying with the face covering mandate. That is a mandate from the Commonwealth, as you all know, but it's not individuals that we're concerned about. We are still getting calls around entities, stores like Best Fitness is the one that was pointed out. I've gotten 5 calls about them. I'll be going there today with 2 of my staff members. It's important to know that face coverings or masks on and contact tracing and testing are going to be the way we get a handle on this virus. And for individuals not comply, no matter what anyone else is saying, is foolish. I talked to you a little bit about the Eastern Equine Encephalitis. The state has mosquito traps across the western part of the state. The state then gathers those mosquitoes, tests them to see if they have EEE or West Nile virus. EEE does have symptoms, fever, headache, 80% of individuals who get West Nile virus show no symptoms. So we are encouraging individuals from dusk to dawn to cover their arms and legs and use mosquito repellent with DEET in it. The city does not spray for mosquitoes. What we do is put larvicide into the sewers to keep the mosquito population down, because that's pretty much where mosquitoes breed. They love water. They love standing water. So we find them obviously a lot in sewers. We're asking residents to make sure they don't have standing waters around their house. Other quick things, cooling centers. We know we're going into a heat wave. We will open cooling centers for Saturday, Sunday, and Monday. They will be at Greenleaf, which is on Parker Street, Kenneflick, which is on Plainfield Street, the Indian Orchard Citizens Council building on Main Street, the community room at Forest Park will be one, and the Mason Square Community Room and the South End Community Center. We are not using city buildings and libraries because of the concerned about COVID, and we know that many of our school buildings are being used as feeding sites and will be throughout the summer. We are shuttering the homeless tent. We're in the process of doing that. The tent that we built down at Worthington Street is currently going to be taking down. Our lease with STCC for that site, or our MOU. We did not pay any money. I just want to be clear. It wasn't a lease. Our MOU expires on July 30th. I've had conversations with the homeless providers. They're feeling good about their individual ability to manage their population. Should we need to isolate and quarantine futuristically, they have set up contingency plans, and so they're feeling good about that. As I said, only one additional person, to my knowledge, has tested positive. The Department of Elder Affairs, thank you, Council President, for your email to Sandy Federico. We are in the process of, again, reaching out to our participants, many of whom don't have access to internet or the ability to join us online. So we're doing that now. The other thing we need to do is get Zoom for the Department of Elder Affairs. They don't currently have a license. And I think that was quite, it was unintentional just because they shuttered in March. And so your recommendation, I wanted you to know that we are following up on, and Sandy Federico will get back to you with a plan. I sent the job description for the Office of Racial Equity and Health Equity to Bill Mahoney. It's being graded and looked at to be put in the city's format. And so that has gone to him. So the other thing I'll just mention quickly is Valley Bikes. And you probably read that the city has, or at least it was my recommendation to the mayor, that Valley Bikes not function in the city of Springfield. It was a part because of our higher COVID rating, but also I was very concerned as I've read about bike sharing programs across the country, and many of them are making sure that they are cleaning the bikes after each use at the various sites. Valley Bikes is not doing that. They're leaving it up to individuals. And we know that the virus lives on surfaces. We don't know. I mean, we've heard from 2 hours to 2 days. So there is some concern. The other thing is the mandate around face coverings would not have been adhered to. And then we don't have an idea around the social distancing protocols. I think we can take another look at that. As you know, the governor said there will be a phase 2 to phase 3. And so I think we can, again, take a look at that. But right now, it was my recommendation to Mayor Sarno that we do not do Valley Bikes in the city right now. That, councilors, is my report.
Thank you, Commissioner. Are there any questions from the council? Councilor Allen.
I have a question. Thanks, President Hurst. Helen, thanks for the report. I didn't hear the first couple of minutes, so I didn't hear the COVID part, but I have heard recently from the Johns Hopkins website, a friend of mine mentioned that, that, how can I say it, that maybe we're not doing as well as it seems like we're doing. Like I refer back to the mayor's update, not this past Monday, but the Monday before, where the guy from Mercy Hospital said, we don't have any cases here right now. And the person, Mark Kurawek, I think was there that week, said, you know, we have to have a handful of cases. And I know overall it's good news, but I'm wondering, at other times I've heard that Hampden County isn't doing as well as it's set, as purportedly has been said. Some ratios aren't as good as they were, et cetera. Can you speak to that? Yeah, and for instance, if I could just generalize that to Massachusetts, you know, Maine still doesn't let Massachusetts people in without quarantining or testing. So have we slipped back at all? Are we not doing as well as some of the basic numbers seem to imply? Could you just comment on that?
Sure. If you look at the data, then it would appear that Massachusetts is doing well. We have some cities and towns where we are seeing slight increases of the ratio of positive cases. In this city, we are seeing the ratio decreasing. However, I am very, very concerned about this virus. And I have to tell you that when I look around at cities and towns and I look around at the rest of the country, I am not sure that Massachusetts can escape going into needing to go back to phase 2 or phase 1, because this virus is highly contagious. It's all around us. Is the data something that we can depend on, and is the data correct? We do, and I think Massachusetts does the best it can to give us accurate data. Is it underreporting? I believe in some cases it could be, because the positive cases are coming from a number of labs and a number of sources. They need to hit DPH, they need to be scrubbed, and they need to be then sent out through MAVEN to systems. So could it be different? Yes. I mean, they're reporting Springfield at 2,119. I'm giving you a different number based on what I know as far as every day looking at those numbers. I am meeting with DPH next week because I want to try to understand where our gap is in our numbers, which seem to be widening. So they could be including probable cases that I'm not including in our numbers. I just don't know that right now. I hope that answers your question. I think we do the best we can. I am very concerned about this virus re-emerging, and that's why we continue to push about the face coverings, hand hygiene, social distancing, because I think we have to do that if we want to remain viable as Massachusetts.
If we're so, I guess my only follow-up would be, if we're doing that well, and the numbers are, you know, as solid as you've reported them to be, and as we see on TV, and Massachusetts always seems to be doing well, then why is a state like Maine, like I've heard Connecticut's doing better than us, that some of the ratios of percentage of positives on testing or percentage of people, like New York uses this thing that, I don't know how they measure it, but that the ratio of whether one person makes, how many more cases can one person with the virus infect? And if you're at 1.0 or above 1.0, you're not in good shape. But if you're at 0.7 or 0.8, that's where you want to be. And that, have you seen that one? Like, I'm just wondering, do you look at that one, or is that talked about in your circles?
I look at data across the country. So the question that you're asking is, what's the prevalence rate where individuals should feel comfortable that the rates are at a manageable level? And so, for example, Springfield is 3.45 as far as the ratio is concerned. We have other places in Massachusetts that are the 0.45. So it's a combination of that ratio that you're seeing across Massachusetts, and it's measured, it should be measured similarly across the nation. The biggest challenge that I think we have is people coming from southern states coming to Massachusetts if you're looking at the cases across the state, they are now saying that it's people from the north who came south that why their prevalence rates are increasing. So, I mean, I think it's difficult to answer your data questions. I'm not an epidemiologist, and so that may be a question that is more for an epidemiologist. We can only go by what we're seeing as far as Massachusetts is concerned and what our prevalence rates, and they're all over the map if you look at each city and town in Massachusetts.
Okay, thank you.
Thank you, Councilor Allen. Councilor Letterman.
Thank you, Mr. Chairman. Good morning, Commissioner. Thank you for the update. And I just had two questions. One was around, certainly we all agree with the call for the Stop the Spread initiative of the governor to be opened also with free testing in Springfield and Western Massachusetts. And we have a pending resolution filed for the July 20th meeting around that. But I'm wondering, in sort of prepping that resolution, I was in touch with some of the different testing centers that do exist in the city, whether that be the urgent cares, the pharmacies, the hospitals. And, certainly it seems that in all of those different scenarios, there are different requirements and parameters for who they might be able to test, what they require the individual to have as sort of a prerequisite to testing, and then also, of course, how they bill that testing. And I'm just wondering if we have that information compiled somewhere that's easily accessible to residents who are seeking a test at the current moment. I just wonder if we have that on the website or if that's available.
So I do know that the Bay State sites, all of them are saying that you need a doctor's order or you need a doctor to give you something to go to the testing site, whether you're symptomatic or asymptomatic. If you're asymptomatic and your doctor is willing to give you something to be order to be tested, it can be tested. CVS, I'm not sure about. I'm told that CVS on Boston Road is doing testing. However, I'm not sure what their criteria is, and you may have that answered. Caring Health Center is only doing their patients at this point. Again, the sites of Bay State has closed the Mason Square site, so they are only doing Carew Street, Brightwood, and High Street at this point. And it is my understanding from Dr. Kerouac and his infectious disease individuals that you need a doctor's order in order to be tested.
Yeah, so that's sort of exactly. And I think if there was a place where that was all in one spot where we could direct constituents who reach out to us, I don't know if that exists on the state website already or on our website, but if it doesn't, it might be worth collecting that info just in the meantime until we do see, hopefully, the no questions asked free testing open up here in the western part of the state, that we do have somewhere folks can get a clear picture of what their options are.
Thank you, Councilor Goodman. That's an excellent recommendation, and we certainly follow through with that. Thank you.
I appreciate that, Commissioner. And Mr. Chairman, just one additional question. I think as we kind of move through the summer, I know that we're kind of headed towards the next school year. And, I've started to receive some communication from parents, teachers, and other concerned individuals, just kind of looking to understand more about what the district's plans are and also what's informing those plans. So I was just wondering sort of what role HHS is playing in that decision making and what things are looking like at the moment.
Well, certainly you know that the final decision will come from DESE in terms of recommendations to school districts. I think you already know that the city of Springfield has been asked to submit plans to DESE, which they're in the process of doing. My staff is working very closely with the school department in an advisory capacity to do what we can in order to be supportive as far as the plans are concerned. So we are working together, but the final decision will come from DESE based on what cities and towns across the Commonwealth submit to them.
Okay, thank you.
Thank you, Councilor Letterman. Are there any other questions from the council? Okay, Commissioner, just a quick question regarding free testing. Is that not happening, or is it merely part of your insurance plan? Co-pays? What does that look like, I guess, is maybe the question I'm asking. I mean, when people ask me, is there free testing? What should my response be?
No. Your
No.
response would be that there is, to our knowledge, there is not free testing. Third parties are being billed, including Mass Health and third-party insurances. And I think that's why it's so critical that we have a site that sites in Western Massachusetts, particularly the city of Springfield. And we certainly know that we have hot spots where we can stand up testing that should be free, and then we can get a better idea of the penetration of the virus. But what I would say to you, Council President, if someone has insurance and wants to have a test done, that they should contact their primary care provider. Most providers are giving the order if an individual asks for the order. So they are not, to my knowledge, denying. The only free testing that was done was what we did at the homeless tent and the homeless providers and the shelter. That was done for free. Well, it wasn't. It was done at minimal cost. We wound up as a city using COVID-19 money just to pay for staffing, but the test itself was not costing the individuals.
So just help me understand. So those free testing sites that were occurring at health centers throughout the state, those were the ones that did not come to Western Mass?
That's correct. If you recall, last time, they had those free health centers, and Karen said that they would do it. I don't know what happened with communication, so let me not even go into it. But there were no health centers in Western Massachusetts who were chosen to stand up a site. And we see that this second time with the announcement that was very recently. And I'm sure that the State Department of Public Health and the governor's office and HHS, Mary Lou Sutters have reasons, but it just appears to be a geographical disparity.
Thank you. If there are no further questions from the council, then that will conclude our weekly update. Thank you so much, Commissioner. Thank you, Tom. We appreciate it, and we'll see you in 2 weeks.
Thank you, and thank you for the reminder. I need it. I appreciate it.
We will try to continue those.
I appreciate it.
Not a problem. Take it easy, everyone.
All right, thanks. Thank you, everybody.
Thank you.